right. Welcome back to Rohrich Knows Podcast, helping you become a better you. So today we're going to have an amazing dermatologist from Bentonville, Arkansas, Dr. Missy Clifton. Welcome. She's going to come and talk to us about medical weight loss. Now, she is an amazing dermatologist. She's really, I think, a Renaissance physician, and she's got a huge practice in Bentonville. So, Missy, welcome. How are you doing?
I am wonderful, Rod. Thank you so much for having me. I always love being on camera and also on the waves with you.
Well, she looks amazing. It's just unbelievable. So tell us so how did you get into the medical weight loss arena, and why, and of course it's an important thing and part of our health. So tell us about that journey.
So I will tell you, so many of my patients were getting, the semaglutide, the tirzepatide, those medications, whether they were the actual, true medication or if they were compounded versions of them. So many of my patients were coming in with rapid weight loss, really severe muscle wasting and things because they weren't really accompanying that with an appropriate diet. And a lot of them were seeing so much facial atrophy, so much thinning of the skin,
right.
A lot of abdominal laxity, to the point that, they really need surgical intervention. A lot of the lasers and things, I really couldn't address it. But really just overall, they didn't look better. They were thinner, but they didn't look better. So my patient, they were like, Doc, what am I going to do? I've lost all this volume. My skin doesn't look good quality. I don't feel healthy. And so we just started, kind of trying to tweak it with patients and really kind of hold their hand and walk them through it as far as what to do to kind of reverse some of the side effects.
So what do you do? In Dallas, same thing. I think every patient now, I have to ask to make sure they're not on semaglutides because they are. It's kind of like in the old days we have to ask about what anti-anxiolytics they're on because everybody's on it. But everybody's on a semaglutide. And sometimes people aren't on it that shouldn't be on it. They're already thin. So, it's kind of the fad thing to do. Now, it's a good drug. And, of course, diabetologists have been using it for years for pre-diabetic and diabetics. So, but it is a counseling thing because you're right. Most of the weight loss is not fat alone; it's muscle. So what do you do? So you counsel them. Do you actually prescribe it? And what do you do to offset some of this and to counsel them on how to truly make it permanent?
So there are a lot of my patients that come to me after they've lost their weight, and sometimes we'll help them with maintenance. Sometimes if they're really, really obese, a lot of my medical patients that have hidradenitis or psoriasis or a lot of these other disorders that really are highly linked to obesity, a lot of those patients, I have no problem prescribing those for those patients. And for patients that are overweight, a BMI more than 30, just for overall health, as long as we're monitoring and keeping track of, diabetes with their primary care doctors and things like that, I have no problem prescribing it for patients. But what I see really predominantly more is patients who have lost a ton of weight. They come to me because cosmetically they want to look better. They want their skin tightened. And then they start to gain the weight back and they want kind of a maintenance. And no one knows what maintenance is on these drugs. They're too new. So there's no cookie cutter prescription. So I have paired up with a nutritionist here in town who I refer my patients to make sure that all of these patients are getting enough protein. We do some lab work to make sure that they're not vitamin D or B12 deficient because a large number of these patients do get vitamin deficiencies. So we're trying to create their whole healthy regimen behind maintaining this weight loss. But the main thing that we're doing is trying to really help them, rebuild their skin and the skin quality and their overall cosmesis.
How do you do that? How do you do that in these patients?
We do a lot of filler. A lot of neurotoxin in areas, that are now really, really wrinkled. So most of the time, they don't just need neurotoxin. They actually need quite a bit of filler or stimulators like Radius or Sculptra. We do quite a lot of radio frequency microneedling for skin tightening. If they have a ton of sun damage along with that, we'll do a lot of times some laser resurfacing. We do full face ablative erbium resurfacing for some of these patients. patients that have a ton of, sun damage along with their laxity. And then abdominally, and on the thighs, for people who have just mild skin laxity, we'll do a lot of radiofrequency microneedling. We're doing a lot of muscle stimulatory work for these patients as well. We have True Body. Some people use M-Sculpt.
Right.
So just to basically trigger these patients to start rebuilding their muscle outside of what they can do at the gym. So we're doing some of that. A lot of these patients end up needing surgical intervention, so they need to go,
Right.
See plastic surgeons,
Right.
especially, the neck, the abdomen.
Right.
There's only so much you're going to be able to do with radiofrequency microneedling.
Yep.
So it's a partnership with these patients that we share with our plastic surgeons as well.
Yeah, no, I agree. And really in these patients, when I see them for a facelift and they want to lose 30 pounds or they're on Ozempic, I say, hey, come back and see me in 6 months, because the worst thing you can do is do that and do a facelift and then they lose 30 pounds and you have to redo it. So you gotta do
Absolutely.
it. And then the maintenance is very important too. I think a lot of it's counseling that, pills never cure anything. It's your mind and your brain and heart that does. Because, it's diet and exercise, but a lot of muscle, we get them on muscle and weight training programs, because so much of that is weight loss is actually from their muscle loss. So, and actually anybody over 50, you're losing muscle loss and you're having muscle loss anyway. So that, along with Ozempic and the semaglutides, really don't help that. I mean, I think that's what people don't understand is that. And I talk to my diabetologist, and they say, well, it's a lifelong drug, especially if you don't counsel them, because the recidivation rate is high in these patients if they don't change their life,
Yeah, it's like over 60% of patients, once they stop it, will gain, I think it's up to about 25 pounds in the first several months after being off of it. So it's not something that you can just start and stop, especially if you're not counseling people on appropriate diet, appropriate protein intake, appropriate weight-bearing exercises to keep that muscle mass. And that's the problem. These have all hit the market so quickly that the counseling is lagging way, way behind.
Right. I agree. And then we have all these clinics and, they're prescribing them and they're not counseling them. And then we have all these issues. And that's, we see these patients all the time. And for us, it's a real problem because we can't operate on them. They have to be off these drugs, the Ozempic, semaglutides, for 2 weeks before, because there's, one of the, the reasons is for gastric emptying. Yeah, so it's a real problem. So for our viewers, Missy, what are the 3 take-home points that you would say are really important for them on the role of these drugs, semaglutides, from your perspective and also from those that want to get plastic surgery?
Yeah, I would say that for most patients, it's not a quick fix. You really need to think about really maintaining your protein, your weight-bearing exercises. All of your overall health needs to be included in this, not just taking a pill. And that your weight loss is probably going to wane over time. You're probably going to regain it. And if you lose the weight way too quickly without taking those nutritional things into account, your cosmetic results are going to really not be great. You're going to lose way too much volume too quickly, and it's harder to correct. So you're going to end up having to spend a lot of money trying to reverse that really rapid weight loss if you don't do it correctly.
Great. Yep. Great. Know before you go. Wise words from Dr. Clifton. Honestly, fantastic, because, you got to know before you go. You got to, pills aren't the cure for hardly anything. So you need a lot of counseling, a high protein diet. I love intermittent fasting too. And just, you need to get, appropriate follow-up and make sure that you keep. It's a lifelong. It's like anything else. It's a lifelong process. So give us your comments, give us your thoughts on this amazing podcast, and we'll look forward to seeing you next time on Helping You Become a Better You. Thank you.